So the last will be the last. This is the part 3 of cranial nerve assessment, which is the last. We are going to focus on motor as well as the reflexes. In motor assessment, we will be assessing the muscle strength, size, tone, coordination, gait and movement. So the muscle size will be assessing whether all the major group of muscles, whether they are bilaterally equal, symmetrical, whether there is any hypertrophy or atrophy. So in muscle strength, we will be giving against the scale, like we will be assessing the muscle groups against resistant. Might be you give resistant and then ask the patient to flex, give resistant, ask the patient to extend and so on. So when they respond, when there is no contraction against resistant, then patient will be getting 0 on 5. If there is a flickering muscle movement, but there is no movement of the hands or lower legs, 1 bar 5. There is possible movement but not against gravity, that the patient will be getting 2 bar 5. There is movement against gravity but not against resistance of the examiner, then 3 bar 5. There is possible movement against some resistance by the examiner, then 4 bar 5. Normal strength, then we give a score of 5 bar 5. To assess the muscle tone, we will be assessing the muscle tone by moving each extremity through its range of more passive exercise motion activity. Hypertonicity is nothing but the tonicity of the muscles. So here you have the hypo as well as hypertonicity. Hypo means decreased muscle tone, hyper means increased muscle tone. The muscle resistant to movement, rigid, whether it is to movement, it is intact or it is very rigid or spastic should be observed. And here you can see that some patients will be having abnormal flexion and abnormal extension, where you can mark it as decortication posture or decerebrate posture. To assess the muscle tone, we have to assess the muscle coordination by gait and station. So gait is the moving pattern and station is how they stand still in that particular area. So first we ask the patient to stand still unless it is not contraindicated and walk through the tandem 1 foot in front of the other in a straight line. If difficulty in standing is indicated and there is poor coordination, don't try this procedure. To assess the movement and gait, examine by all the joints through a full range of motion, and might be some patients may have severe pain, contractures as well as muscle resistance. To assess the sensory function of all the muscle areas, you can use light touch method, pain method, assessing by some sort of hot water or cold water test, that is temperature, assessing the vibration test by using the tuning fork, assessing the positioning test by asking the client to close the eyes and just you place some of the objects on the patient's hands, or you draw some objects, or you give some defined lines or parameters, then that position test can be analyzed. And discrimination, that is you give some shapes or some coins or some objects and they have to just feel by touching, and after just by touching, if they are able to sense it out, then that is said to be intact, that is sensory. So in sensory, this will be done simultaneously, but see that while doing this test, the patient eyes are kept very closed and tightly in position, and we use different sorts of stimuli to assess the sensory function. To assess the cerebellar function, which is the second last of our cranial nerve assessment, is the cerebellar function, that is the balance and coordination test. So here we will be using finger to finger test as well as finger to nose test. So here finger to finger test is that the examiner, the patient should place his index finger to the examiner's index finger. So this will be like whenever the patient is trying to put that index finger onto the examiner's finger, the position will be changed to many areas and see the inference whether the patient is able to have tight inferences. And if the patient is having delayed postures, might be you place it on the right side and very delayedly they are responding, that shows that there is some higher cortical cerebellar dysfunction. As well as in finger to nose test, what we will explain is that the patient should extend the index finger and then touch the tip of the nose several times in rapid, and this is done by both the eyes open as well as eyes closed. to assess the Romberger's test, which we call it as the balance test, which is already done in the to assess the vestibulocochlear nerve. So we'll be asking the patient to stand still together with his eyes closed and to remain in position for at least 10 seconds. If the patient is having no imbalances, then he'll be able to stand still for a longer time. If the patient feels giddiness within less than 10 seconds, then it indicates that there is some balance and coordination dysfunction. Then we also do the tandem walking test, that is walking on heels to toes and toes to heels in a straight line. The last assessment will be the reflexes. So to assess the reflexes, we will be assessing the superficial as well as the deep reflexes. To assess the superficial reflexes, we will be focusing on the abdominal reflex, plantar reflex, corneal reflex, gag reflex, cremastic reflex and anal reflex. To assess for the deep tendon reflexes, which is the biceps, triceps, brachioradialis jerk, patellar jerk and Achilles tendons jerk. So as a nurse, we have to have this role while doing the cranial nerve assessment. See that you give a calm and quiet environment to the patient and always explain the procedure. If the patient is conscious, if the patient is unconscious, explain to the family member and collect the history. Set up the tray nearby to the patient. Then assess the vitals and consciousness. Then start with the mental status examination. Assess the cranial nerve, motor, sensory and cerebellar function. During examination, see that you give a good support to the patient and the family, and finally record everything and it should be documented, and as well as in case of severe abnormalities, please escalate to the doctor immediately. To summarize, cranial nerve assessment is to be done hourly basis on all the critical care units as well as neuro ICUs and neuro post-op ICUs, and will be the baseline factor to find out or depict even a mild change or mild prognosis and put it onto the consultation room immediately. To conclude, cranial nerve assessment will not only cranial, the central nervous system assessment, that is your neuro assessment, will be a contributing factor to analyze the central nervous system as well as the sensory and motor inputs. So thank you all for your patient listening so far on the neuro assessment. See you in the next class with some other new topic. Thank you all.